Welcome to the Mexpreneurs Podcast, the podcast about the stories of Mexican tech startup founders who are building world-class, fast-growing companies and having a positive impact at a large scale. My name is Sergio Chavez. I'm a Mexican based in Germany, a tech startup founder, executive, and mentor, and your host. Today we welcome back Gabriel Garza. Gabriel, together with Guillermo Loyo, are the founders of DocTour, a telemedicine startup based in Cancun, Mexico. DocTour started with a mission to address the healthcare needs of international tourists visiting Mexico by offering affordable telemedicine consultations. The platform has since expanded to offer comprehensive corporate health services, white label solutions for insurance companies, and a new focus on managing chronic diseases. DocTour is also working on a new social impact project that will provide free telemedicine consultations for children and families in rural areas of Mexico, bringing much-needed healthcare to underserved communities. Gabriel is Managing Director and Guillermo is Operations Director. Both are originally from Mexico. Gabriel is based in Porto Alegre, Brazil, while Guillermo is based in Cancun. Gabriel is responsible for the overall company vision, leadership, strategy, go-to-market, and partnerships. He leads DocTour remotely from his home base in Brazil. You can learn more about Gabriel and his professional journey through the previous podcast episode. Guillermo is responsible for the operations of DocTour, working directly with customers and partners and managing DocTour's medical staff. Guillermo is a certified doctor specialized in telemedicine. Before DocTour, he worked at multiple hotels and resorts in Cancun, attending international travelers. I hope you enjoy. Support for this episode comes from Skyflare, a cybersecurity company with a mission to make e-commerce safe for online shops and which currently protects dozens of Shopify-based businesses through its 360 degrees holistic protection. As an online shop owner, you know that every cent you spend in online advertisement counts, especially in Google AdWords. Therefore, keeping a tight control of your budget and the ROI are essential. Nevertheless, there are bad actors out there who can make those costs explode. Skyflare's click fraud protection solution helps you prevent and resolve those threats. At Mexpreneurs, we had the privilege to have Skyflare's founders in the podcast, including Juan Ocampo, a Mexican tech startup founder and Skyflare's chief operations officer. Visit skyflare.com/mexpreneurs to learn more and also to get a 10% discount during your first 3 months of your annual subscription. Skyflare is at the moment available in Europe, Mexico, and Canada through the Shopify App Store. Hello, Gabriel. Welcome back.
Thank you very much, Sergio. Glad to be here.
Great to see you, Gabriel. So, Gabriel, please tell us, what is DocTour?
For us, we want to consider it a lifestyle because we live it as founders. But we are a digital medical service company. When we started to solve health problems of tourists during their travel in Mexico. So that is why the name DocTour, that is the mix of doctor and tourism. We patched the two words together. But DocTour also means doctor in different languages. So in a lot of languages is the ancient way of calling doctors. If someone that does not speak Spanish is looking or Googling a doctor, he might stumble on us because we have the correct word that he's looking. So that was the basic idea, but we evolved very quickly, not only for tourism, but we also went for corporate health. And we expanded our services during the pandemic as a need for the companies to keep and maintain healthy workers. We offered the telemedicine and digital health services that in a holistic way. We included nutrition, psychology, general practitioner, pediatrician, the basic needs for the employee and his family also. We started offering those services and then we expanded to white label services. So we started working for insurance companies, assistance companies, providing telemedicine services. This year, we also expanded further into chronic disease management. We are opening this new line of business. It's been on and off since January, but right now we are launching it officially. We are starting on the chronic disease management, aided by artificial intelligence to help the follow-up and the adherence of the patients. This year is a very good year for us.
There's a lot of things to unpack in that initial definition that you gave. But let's say going back to the roots of DocTour. So you mentioned about basically medical assistance for tourists. So how did the whole idea started? Why Mexico? Because also you're based in Brazil. Like why Mexico? How did this whole came to life?
It's a funny story how we started. I was doing my master's degree in France in 2014. And my partner now, one day I received a call out of nowhere and he was like, "Hey, how are you?" And he's like, "I'm with a patient and he's French and he does not speak Spanish nor English and he's very sick and I need to understand what is going on with him." So I made it as an interpreter in that call. It worked very well. The patient was recovered and he was very thankful. And it happened a couple of times in the span of 3-4 months. We said, maybe there's an opportunity here. My partner was working as a doctor for hotels. He was seeing patients, international patients, on a daily basis. And he's bilingual. So English, his mom is American. So even though he is Mexican and he has lived all his life in Mexico, he is bilingual because on the mother side. We saw that opportunity and we saw that there were some major areas of improvement for the international tourists. Why? It's what we call some vices in the culture of serving tourists. Everyone in the chain, any service, not even the medical, wants a commission, wants a part of the tourist's money. So what happens? Normally there's a little chain where the tourist goes and travels through that chain of services. And in that chain, every component or every part or every person that interacts wants a part of it. At the end, any service for the tourists, that is why we say it's tourist prices. It's more expensive than the local prices. We wanted to end that. We started thinking, okay, how do we break that cycle? Because, for example, if you get sick in Cancun, normally you will go to the hotel doctor. That consultation will cost you, I don't know, $300. And the doctor gets also, for example, in most part of the hotels or the industry, the doctor gets a commission if he sends you to an ambulance to the hospital. The ambulance guy gets a commission if he sends you to the doctor. The emergency doctor gets a commission if he sends the patient to surgery. Everything goes that way in the chain, and at the end, for minor problems, the patient ends up in the hospital with a big bill to pay. And what happens? Normally, when they travel, a lot of the business, for example, in Cancun, is all inclusive. So when you travel all inclusive, you have everything in the hotel. So you do not need to spend any money. And people travel without any extra cash. There are a lot of problems where people are not able to pay the medical bills, and it's a big drama. So we wanted to end that. We tried negotiating with hotels. We were unable. So we started attacking the market directly from our website, offering affordable services, high quality services at a local price. And when we negotiated with our providers, that is, if we need to send someone to the hospital, the agreement we made was, I don't want a commission, give them a local price, because we want to keep the experience of being not an expensive experience to get your health back on track, to keep enjoying your vacations, because everyone is on vacation. Those negotiations were made and we were successful, and we started that model. When we started the model, the pandemic hit. Tourism went down a lot. So we had a problem there. We had to reinvent ourselves, and that is when we started the corporate health services. But at the same time, the authorities started requesting for international travelers the COVID testing reports. So we started doing COVID testing for our travel. And we put a service where we go to your hotel, we go to your Airbnb, and we send the laboratory personnel, they take the samples and everything. We offered that service and it was successful. And that made us a little place in that market that was highly competitive and highly enclosed, because new players are not always welcome in that industry because it's already very established and long relationship between other actors and everything. We did that and it worked. And then when we opened our corporate health services, we expanded a little bit more And then we started giving and providing services for insurances. And little by little, we started to take a little more place, and we started to position ourselves as a reference for occupational health. That is how we got there. It's a story where two friends gave a solution for a problem that was there at the moment, but that was the problem that we were solving. So we turned that idea into a business at the end.
And I can also imagine this is at the end of the day a global problem, like all tourists that are traveling for pleasure primarily. But I would also assume it's equally applicable to business travelers are facing the similar challenges that no matter where they go, the local medical community is incentivized so that they keep flowing through the different clinics and specialists and so forth, which probably they don't need instead of getting the fair and good treatment. So the vision from DocTour is then that, let's say, every traveler should have like a good but also fair medical treatment. Is it along those lines that you're thinking about?
There's no need to ruin your vacation because of a cold or a little health issue. The idea is we help you get back on your vacations as soon as possible. Get better to continue enjoy your vacations instead of moving you through another system and then you ending in a hospital and 3 days passed and that's it, your vacation is over. It's along those lines that we started. We go to you. You don't need to move from your hotel, from your Airbnb. And if you need anything, we guarantee local prices for you. And we do everything we can for you to recover, for you to keep enjoying your vacation. It was along those lines.
And what you mentioned also in terms of the traction of the milestones that you've achieved, it's incredible because you've gone through these telemedicine concept for tourists, then corporate health. There's been different new lines of business that you've been creating throughout the process. What are some of the major milestones that you've achieved in addition to the opening of these new business lines and these new ventures? So what are some of the big achievements, big milestones that you guys have had?
We've been published by major news outlets. One of them is Health Tech World from UK and from Mexico Business News also. So we got a space to post our opinion as expert contributors also in health. That is something that we cherish a lot because it allows us to expose our view on certain topics related to health and to travel. We also got awards as the Pro Network Award on 2022 and 2021, considered as one of the 100 startups with most potential in Latin America. Twice in a row, we won that prize. And I was also awarded in 2021 one of the 100 entrepreneurs of Mexico by the Asociación de Emprendedores, ASEM. Those were the awards. As traction, we already gave, thousands of COVID tests, thousands of consultations. We have a dozen of corporate clients that make a nice population for us to take care. Right now, we are embarking on a new journey with the chronic disease management. That is our new business line. We are constructing it. We are having the first clients, a small process, because chronic disease in Mexico, it's very peculiar. In Mexico, people are not used to prevention. They normally get medical attention once something happens. The focus we have is on prevention, on improve your quality of life, of work, doing preventive tasks. For example, for diabetes, we help you measure daily your glucose. We set up alerts. So if the glucose level is above what the doctor said, the doctor will get a notification and will consult with you to adjust the medication. It's a prevention cycle that we want to implement in order to improve the lives of Mexicans. Mexico is one of the countries with the most percentage of diabetics, of cardiovascular diseases, and obesity. So we need to work on that for the population in order to have a better population, a happier population, a healthier population. That is the basic experience and milestone we have until now.
And if I understand correctly, at the end of the day, also that core know-how technology that you've developed, it's different use cases that you're tackling, but still, let's say the core of that medical expertise, that telemedicine expertise, the technology that you've been building, it remains the same, but it's different use cases that you're tackling.
At the end, it's telemedicine, but we locate that in different areas, in different industries, and in different cases. That is why we were able to open different business lines providing basically the same services.
And you also mentioned that right now the focus has been on Mexico, but you're physically based in Brazil. But why is still Mexico the biggest focus? Or are you also looking into expanding into other countries?
We do want to expand. We consider two ways of expanding in our case. One is for tourism, go abroad, but to sell the products for the tourists when they travel to Mexico. It's not providing the services abroad, it's selling the services for the travelers that will travel to Mexico. That is one way of expanding. And the other one is to provide directly our services in another country. The first one we tried in Brazil to open a DocTour to work with travel agencies. But when we did that, the Mexican government imposed a visa for the Brazilian tourists. So tourists had now, they need to schedule an interview at the consulate in Sao Paulo or in Brasilia. That interview, sometimes it will be like 2 months, 3 months ahead. And you are not guaranteed to get the visa. So you cannot plan your trip. And all of that had a big impact in the travel agents that we were working with, and their demand fell down. We had to put that project aside for a little bit, and we are waiting now on the new negotiations, expecting that the visa ban that they imposed will be lifted. That way we could continue. The other way is to provide our services abroad, but there is a lot of limitations concerning medical services. One thing is your platform, your system in all of the countries where you want to go needs to be approved, needs to be certified, needs to comply with different laws and privacy protection regulations. That makes it a little bit harder to expand abroad, and as well as the medical services. For example, a doctor in Mexico cannot give a consultation in another country because the doctors are issued their license for the country they are working. So if you want to give or provide medical services in another country, either you need to be certified in that country also as a physician, or you need to hire local doctors. That is some of the barriers that we encountered when we thought about expanding. And as we are self-funded for the moment, we do not have that capital to, okay, let's pay those services, let's pay the certification, let's pay everything, and we just grab that market. It's been a different journey for us, but we are still looking at expanding. But right now we're mainly focused on Mexico because we want to expand our market share there.
And also remember from our previous conversation about the focus on profitability and not just growing for the sake of growing and rapidly expanding, but actually creating a sustainable, profitable business. Therefore, it's been a deliberate effort to go step by step.
Yes, the traditional way. When you, for example, you get a funding round, for example, a seed round, you get a lot of money, and that money normally will be for marketing and sales, big part of it, because what you need is to sell. But we had some clients also in the corporate health that were like 100 employees for 6 months and then back to 10. It's a different roller coaster if you want to see it that way. When you start in funding rounds, the money you get is used to target very specific goals that do not guarantee you your positioning, do not guarantee you your profitability. It's part of the money you're burning to take care of that round. It's a different path for us in that way.
We will be right back for a conversation with our guest. Support for this episode comes from Partnership Leaders, the leading community of partnership professionals and executives in SaaS and tech with over 1,500 members globally. We're living in the decade of the ecosystem, and every CEO needs to become a partnership leader. Just take a look at the top companies in the world today like Microsoft, Google, and Apple. They have all become platform companies, and partnership executives in IT have been the ones leading these transformations. Partnership Leaders brings these executives together and is building a playbook to enable CEOs and business leaders across industries to transform their organizations into platform companies.
If you're a tech startup founder, Partnership Leaders is the place for you to learn how to leverage partnerships to take your business to the next level. I'm a member of PL and co-host of the Germany chapter and have seen firsthand the richness and value of this incredible community. Visit partnershipleaders.com to learn more and to apply to become a member. Make sure to mention in your application that Mexpreneurs referred you so you can receive a special price if your application is accepted.
Now, Gabriel, I would love to switch gears to the team behind DocTour. So I have the pleasure to talk to you as one of the founders. You also mentioned about your partner. Could you please briefly walk us through your partner and the people behind the company?
We managed to put together a great team. Everyone is super special and everyone contributes a lot to the company. So we have on one side Dr. Guillermo. He oversees all the medical operations. He's a doctor that is specializing in telemedicine because telemedicine is different from a normal consultation. The way the doctors approach the patient is different. It's more a conversational diagnostic than a physical diagnostic. He specialized a lot in that part and he trained our doctors. We also have a team of doctors. We have 3 doctors, 2 psychologists, and 2 nutritionists also that are in the medical team. And Dr. Guillermo oversees everything in that part. Also, the relations with our providers, that is the medical laboratories, pharmacies, hospitals. All of that operation is Guillermo's operation. I myself oversee the administrative part of the business, the negotiations and the management of the company itself. And we have Oscar, that is our commercial director. He is someone very, very capable when we go to selling. So he helped us a lot in positioning the brand and positioning our services, especially in the corporate arena. The rest of the team is not doctors per se. It's outsourced. It's part of a lean strategy where you outsource the rest, but it's still persons that work with us on a daily basis. So we have the design team, we have the lawyers, we have the accountant, we have all of those personnel that helps us facilitate our daily lives, our processes. They are always contributing with great ideas and ways to improve our processes and everything. And we have also a great relationship with providers, especially, for example, cybersecurity providers that we have. We have a great relationship with a company called Digital Keeper. So because everything is remote and web-based, we need to invest a lot in that part. So we made an alliance with them and we are providing also the services to them. So it's a two-way relationship. They have helped us a lot to organize the way we see security nowadays. So that is great. And we also have a team of mentors and consultants that periodically they give us advice and they pull our ears to tell us, hey, no, that is not the way you need to do this. But they helped us a lot to get back to earth because we can dream a lot when we are entrepreneurs. But then you get the mentor saying, no. Wait, go back and establish yourself very good, ground yourself. That is the team behind our success for now. So it's a great team. We want to, little by little, start to expand that team and maybe those outsourced services start to hire them internally, little by little. But that is going to be as we grow by selling and by positioning. That's the strategy for now.
A small core team, especially covering the telemedicine expertise. It was super interesting what you mentioned about Guillermo, his particular expertise in telemedicine, which is different from other branches of medicine. And a strong focus there, and then everything else with a strong partner network that you guys have built. That's amazing. Now, Gabriel, what I would love is to talk about your priorities for the next months. Let's say, what are some of the big things that are coming up for DocTour in the next 3 to 6 months?
We are starting a new project we are very excited about. We are going to provide free medical consultation for kids in rural areas, kids and their families. That is a big challenge because up until now, those rural areas were very left behind concerning medical attention and access to medical services due to the conditions of their living conditions. They are normally located in some areas with hard access for even sometimes trucks or any car. So what we did is we are mounting some points of medical attention with the help of the community. We are empowering some families to put the point alongside their property. And normally, that person is the person in the community that knows how to inject or to put a bandage around a wound. So we already profit from that. And he or she, they are going to be acting as a nurse for the doctor. So they will help the doctor take the vital signs, temperature, etc. And we will provide that service free. We are doing this with the cooperation of the government of Nuevo León and a foundation. That is where we started. The initial project was Tablet Aprendo, where they give the kids a tablet with educational content, and we provided the educational content in health and nutrition. We started like that, and we said, well, why don't we go a step further and provide the medical services? That is our social project. Let's provide those for free for the families. And the idea is to expand it. It has a cost, but the foundation is in charge of getting those donations and getting those resources to go to the different projects, in this case, the educational project and the health project. So we are very excited about this. We are starting this project this month with 2 points. There were a lot of technological issues, so we solved them with a Starlink connection. We managed to get a Starlink connection for that rural area. We got all the computers, everything we need. And now there's another company that is joining the project that they will make like a cabin for telemedicine made out of recyclable materials. That is what we want to establish. So we can put a point in different communities made of recycled material to provide those services. We are very excited about that. We are launching, as we said, the chronic disease management. That is one of our priorities this year and next year. And we are about to launch also a project for the NOM 035 certification. That is the psychosocial liabilities in the workplace. So now, by law, every company is required to provide first to evaluate who is being very stressed or who needs some psychological attention due to workplace conditions. They need to identify those people, and then they are obliged to provide psychological attention for those people. It's a process that it's kind of like a certification that every company needs to do every year, every 2 years. And it's a service that we are now providing because we already provide the psychological medical attention. We just went a step backwards to put the diagnostic and then provide the attention. So that is another project we are very excited to implement.
Just with those 3 projects that you mentioned, I can imagine that you already have your hands full, plus all of the other things that you're already doing. Gabriel, and unfortunately, we're reaching the end of our conversation. And what I would love is to wrap up our conversation again with your best advice for aspiring founders. In our previous conversation, I think you already gave us a great advice along the lines of funding and creating a sustainable, profitable business. I would love just to ask you for one more advice for those that are listening.
I was doing some mentorship for health startups in an acceleration program for a venture capital. And one of the things that I saw the most is the following. We normally construct a solution and then we try to find the problem. When you do that, it's very hard to position your solution afterwards. So one of the best advices that we gave all of those startups and companies is find the problem. And when you find the problem that you're solving, the rest will fall in place. It's finding what is the pain that you are solving for your customer. That is basically the first thing you need to do. Do not focus on a big tech solution or anything because, for example, some people were wanting to implement a platform with artificial intelligence. And okay, but who's going to be your customer? What is the problem you're solving? Oh, we still don't know. Okay, so you need to take a knee and let's find the problem because you already developed a kind of a solution. But before you develop that technology and start investing on that, you need to find a solution. So the best advice is, okay, what's the path where you can sell as quick as possible? Why? That is your first customer. You need to find it. And when you find your first customer, you find your problem. You find everything you need. Instead of developing a solution and then spending a lot of time in sales personnel to position the solution, find the problem, solve the problem, and the solution will start selling itself. That is one of the advice I can give other entrepreneurs.
That is a fantastic way to wrap up. Gabriel, well, thank you very much for the great advice. And also thank you for sharing your journey and the great things that you guys are doing at DocTour. We're going to keep a close eye on what you guys are going to be doing in the following months. But in the meantime, thank you very much for being here today with us.
No, at the contrary, thank you, Sergio. It's always a pleasure to talk with you and to share our experience with your audience.
Fantastic. Thank you very much, Gabriel.
Thank you. Goodbye.
Bye-bye. And thanks to you for joining us today. Please remember to subscribe via your favorite podcast app to be notified about new episodes and share with us your feedback. We would love to hear from you. Thank you also to the Maxpreneurs team, Valeria Morel, Hector Barragan from Hyper Voltage, Francisco Jaimes, Pamela Elizalde, Katia Cruz, Rocío Marroquín. I am Sergio Chavez. See you next time.